this doctor referred us to a doctor in regards to IVF in Toronto. And yeah, so we met with that doctor who was so thorough in regards to like requesting all of the documentation on my husband's side of things, on my side of things. He also had me do blood work. So, which anybody who hasn't been through this and is considering IVF, I want you to know this ahead of time because I didn't. So I had to do blood work. I honestly don't recall. It was like on day like 3 of my cycle and then again on like day 15. And to my understanding, that was checking like my hormone variations, whether they were normal, abnormal, whether I ovulate, that kind of a thing. However, the second round of blood work for that cycle, I wasn't prepared, and they actually drew, it was either 12 or 13 vials of blood. And I just mentioned that because for me personally, I have had so many surgeries. I like to give back. So I as often, like whenever I can, I donate blood. But I've actually, for all of the times I've gone to try and donate blood, they always test you first to see if your like iron and levels are high enough. I've actually only been able to donate twice. So, oh, just a phone call coming in. I'll ignore that. I've only been able to actually donate blood twice. So when I have 13 vials of blood drawn from me, I actually went in the morning and then tried to go to work. And like I tried and I was just like, I need to go home. I'm so dizzy. I'm so faint. So I just want people like prepared for that. If that's an issue for you, know that there's a lot of blood that's going to be taken and make plans around that. So yeah, we did that. We met with our doctor in Toronto. I just felt like we were in really good hands. So we decided to move forward with IVF. And so the IVF, we moved forward with that in 2016. So at the beginning, so we're starting stims. I will tell you now that since 2016, I don't remember like my medication protocol at all. I know that I did a lot of injections, and I also know that, and I was also again like closely monitored blood work and ultrasounds very frequently. And then as the follicles grew larger, I was in on a daily basis for monitoring. And for me personally, for whatever reason, my body was not responding like as expected to the stimulants to make follicles grow. So we ended up kind of like doing a combination of medications that would stop me from ovulating, but you know, we were just really trying to get those follicles growing. So we did like an extended protocol. And at the end of that, when it came to egg retrieval, I had 5 eggs. So that is the minimum that this clinic will move forward with an egg retrieval. So at least we hit the minimum. And you know, I have heard stories of a lot of women who have like 30, but that's what happened for us. And yeah, when it comes to retrieval, I just want to say, I don't know how things are done at all clinics, but at our clinic in particular, I was given like an intravenous or yeah, like an IV, like sedative, but they call it like a twilight sedative. So I was not knocked out. I was awake for it. And it was a very intense experience for me. And I just want people to be prepared for that. But like mentally, I just thought, you know what? Honestly, they were so quick and so accurate. It was amazing to me. That, you know, I don't know, it might have been 10 or 15 minutes of that to possibly have our lifelong dream. It was worth it, but I do want people to be prepared. So after egg retrieval, we found out that of the 5 eggs that were retrieved, 4 were mature. So now I want to get into the science component of things. So for us, we chose to do ICSI, which is where the sperm is like literally placed into the egg, as opposed to like fighting through the sort of shell and trying to get in. So we used ICSI. We also used something called spindle view, which is not offered at all clinics. So I want to throw that out there to folks if they haven't heard of it before. So essentially, spindle view in a nutshell is a great technology that allows the technician to evaluate egg quality prior to moving forward with ICSI. So, you know, there are a lot of folks out there who it makes more sense for them like to make the embryo and then do PGS testing to test for any abnormalities. For us, so spindle view, you know, we were still young and weren't concerned about egg quality in its entirety, but basically it's a proactive measure to see that, you know, there aren't abnormalities in the sperm or the egg before merging them. And yeah, it's just fantastic. Also, we used something called assisted hatching. So through spindle view, once ICSI is completed, they are incubated. The potential embryos are incubated, and like it's just constant imagery of cell growth and development. So again, it's proactive as far as any abnormalities in cell growth. However, once cell growth hits a certain point, in some cases, those cells are looking to get out of the shell of the egg, and if they're struggling at all, assisted hatching, basically using a laser, just kind of, you know, puncture, not really even punctures, just softens the shell of the egg and allows cell growth to continue. So we used all 3. We were going all in. And at the end of the day, for having such a low egg count and only 4 mature, we actually ended up with all 4 making it to 5-day blastocysts that, you know, based on the spindle view perspective, were not abnormal. So that was incredible. And so again, we're in 2016. We've done this. I was very fortunate that even though we extended my protocol, I wasn't at risk for OHSS. So we went ahead and moved forward with a fresh transfer and did our 2-week wait and got a positive. It was so incredible and magical for me and my husband. We've literally never seen this on the plus sign on a pregnancy test before, so that was great. I went in for blood work at my clinic to check exactly what my numbers for HCG were, and then I went back 2 days later to make sure that that number was doubling. So far it's looking like a very viable pregnancy. I think I did blood work at least twice, maybe 3 times, and everything was looking really good. So from then I continued on my medication protocol and waited until week 6 for an ultrasound. At that point, the embryo or fetus, I guess it's still, whatever it is at that point, would be visible on ultrasound, and there's even a possibility of hearing heartbeat. So I went in at 6 weeks to do my ultrasound. The technician didn't let me see anything, didn't say anything. I felt really strange about that. And yeah, so then I got a call from my doctor saying that they didn't see a heartbeat. However, my doctor is very experienced and I appreciate his optimism and honesty. So he told us that, you know, there's no heartbeat at the moment. The shape is a little unusual, but he's literally seen exactly that case, and to just give it a few more weeks and see if we see a heartbeat and if things look improved. So we waited 2 weeks, we went for the ultrasound, and I knew this time, because I knew the technicians weren't allowed to tell me a lot, all I asked was, because they measure like how many weeks it's measuring. So the first time it was measuring 6 weeks perfectly for my first ultrasound. My dogs are whining, sorry about that. So I went in for my ultrasound at 8 weeks. I asked the technician, because they can tell me this. I asked them how many weeks it was measuring, and it was like 7 weeks one day at 8, just over 8 weeks. So at that point I kind of knew. And then I heard from my doctor, and that was confirmed. We had I was going to miscarry. The only reason that baby was still there was because of the medication I was on. So I was advised to stop my medication, and I did. And I waited a week and was hoping to just have a natural miscarriage, and I did not. So I was referred to a gynecologist local to me to assist me with the miscarriage. So I was prescribed, oh my gosh, how do you say this? Misoprostol. So basically they're tablets you take, and it just induces, cramping and just the release of everything from your uterus. So I went through that process, which I'm not gonna lie, I was prescribed the medication to help me with my miscarriage and Tylenol 3 to go with it. So I knew I was in for something that wasn't going to be fantastic. But for me, for what it's worth, I actually felt like I had really severe, cramping sort of contractions. I would say though that only lasted for a couple of hours, and then I could just feel pressure. So I went to the bathroom, and sort of this mass was released, and immediately the pain and cramping was gone. Now that said, I was told that I could experience very heavy bleeding for up to 2 weeks. And again, that bleeding was extremely heavy. But I was advised that was normal, and that's fine. But I just want, if this is something that ever happens to someone, I want them to be very aware of very heavy. I was also told that if I bled through a pad in less than an hour, that I should go to the hospital. And I was sort of just passing that for the first 48 hours, I would say. And then things started slowing down to something more manageable. So I did not go to the hospital. However, I was told the bleeding could continue for up to 2 weeks. At about 2.5 weeks, I was still bleeding, and I started to feel really sick and feverish. So my doctor's office wasn't open, and especially when I had developed the fever, my husband kind of decided, I think we need to get you checked out. So I ended up going to the local emergency department, and they were really great with me. And they did an ultrasound, and they also did a test to see if I had a septic infection. And I did not have a septic infection, so I appreciate them for being thorough on that. But there was still tissue in my uterus. So at that point, I was referred back to the gynecologist, and we had a conversation, and essentially at that point, there wasn't an option. I had to have a DNC to clear that tissue. So I did the DNC. So that is a procedure that's done under anesthetic, and you are knocked out for this one. And they literally just open the cervix, and just with their medical tools like scrape the lining of the uterus all the way around. However, again, just my opinion and the conversation I had with the doctor, it sounds like I maybe put myself through more than I needed to, because I did have the option of doing the DNC from the beginning. But to be honest, emotionally, passing that mass myself had some therapeutic value to me as well. And then from a medical perspective, if I had done a DNC like at that sort of like 9-week point, my doctor advised me like still the chances are very minimum, but the uterine lining is much more fragile at that point. So there is a possibility of a DNC going wrong and kind of like slicing into the uterus rather than just scraping around. Not to scare people, I'm just saying, like, make sure that you have this conversation with your doctor. Now, because I had taken the medication to assist me with my miscarriage and some time had gone by and my hormones were in a different state, my uterus was like a little more firm to be able to handle that sort of scrape. So I, in actuality, feel that I limited any potential damage that could have occurred from the DNC process. So I'm okay with what happened. So that was good. So needless to say, after that, we needed some time. So we just kind of got back to us, got back to life. Life got a little crazy, to be honest. We had some life changes. So we stepped away from fertility treatment for a couple of years. And then in 2018, in January, so it just became 2018, we decided we were ready and we were going to contact our doctor in our reproductive endocrinologist in Toronto and move forward. So because it had been some time, my doctor, and because of the miscarriage, my doctor wanted to redo the blood work and stuff, which this time I knew what to expect. And he also wanted to do a sonohystogram, which essentially is an ultrasound performed by an ultrasound technician and a doctor, where they insert just a salt saline solution through the cervix, and using ultrasound and actually air bubbles with the saline, essentially it allows them to get a really good imaging in regards to the uterus and fallopian tubes and all of that. So the results of that, I thought okay, we're just doing this routinely and we're ready, we're doing this again. Unfortunately, we were not. It was discovered that I had what's called a hydrosalpinx, and again on my left side. So a hydrosalpinx is where the fallopian tube essentially fills with fluid. And this is obviously dangerous because rupture could occur. In some cases, it's not significant enough that they're concerned about that, but it is definitely a fertility issue because the environment of the uterus is so specific that this fluid could potentially leak into the uterus during transfer and whatnot and affect the environment. So mine, however, was large enough that rupture was a concern. So February in 2018, I had another surgery to have the hydrosalpinx removed, which included removing the entire fallopian tube. That's how that's done. I was fortunate this time. I was able to have that surgery performed by laparoscopy. Excuse me. So I was uncomfortable afterwards, but recovery time was much less. So that was good. So we did the laparoscopy, and from there we wanted to wait a minimum of 3 months before discussing a frozen embryo transfer. So we did do a frozen embryo transfer. We did not actually do that though until we started our protocol in November of 2018, and again, you can watch my other videos. I go into great detail about what medications I'm on side effects I'm feeling, cycle monitoring, transfer day, the whole thing. You can check that out in my other videos. So moving forward, we'll have our meeting on the 23rd. We might just want to modify the medications that I was prescribed in my original protocol, because I think I had some adverse reactions to that. But yeah, I'll catch up with you guys after the meeting on the 23rd. I hope that our story is helpful to folks out there. I hope that, like, lots of you, don't have to have so many surgeries and wait so long. And you know what, if you've had as many or more, had to wait longer, or had male factor, which adds a huge complication, I just have to say, like, you are a true warrior and I admire you greatly. And I just wish you all the best, and I'll be back in touch on after our appointment on the 23rd. So everybody keep well. Wish us luck.